Hi, I'm Evan. I run the Washington Heights-Inwood Mask Block. I am speaking with Christine Montefiore out in Ohio, who is an RN. And just before we started recording, we were talking about some experiences that Christine has had, dealing with masking in healthcare settings, as in this case, a patient. So feel free to start wherever you feel like starting.
Sure, sure. So, Evan and I were speaking before the recording, just about the topic of approaching providers about masking in healthcare in the context of, um, unfortunately, my family has had the experience in the last couple weeks of having to interact with a couple different healthcare systems for my husband who needs, it turns out, an ankle replacement. So we had a visit at a local large hospital system's outpatient orthopedic clinic where we came into the appointment having no expectation that anybody would be wearing masks. We live in Ohio. We live in Cincinnati specifically, which is not exactly the nexus of great public health practice. Versus the pandemic, it's politically very conservative, and I hate how those two things go together these days. But anyway, we made an outpatient orthopedics appointment. This is a new physician to us. This is a new problem. We've never been there before, and as a practice, we wear N95s whenever we are in shared indoor space or close quarters outdoors. So we show up to the appointment. And when we came to the clinic door, there was a sign taped to it, just printed off from the computer that says masks are optional in this practice. So somebody obviously took the time to type that up and print it out and stick it on the door. And we went in and we waited in the waiting room, and there was no one else there wearing a mask of any kind, not patients, not staff, not physicians. And the MA came out and called us back to the exam room, took the, what brings you in today question history, and then the surgeon's physician assistant, the PA, came in, and the just like everybody else there, the PA was not masked in any way, shape, or form. My husband and I are sitting there in our N95s, but we're not there about anything, having to do with anything except for my husband's ankle. And the PA started taking the orthopedic history, but stopped himself to ask us why the masks. And it dawned on me in that moment that that might have been a valid question 4.5 years ago or 5 years ago, if the provider was concerned, about back when we thought vaccination status conferred more protection than it does, like that would have been a fair question at some other point in the timeline. But really, almost 6 years into this, when your practice literally has a sign taped to the door that masks are optional, like, they're optional. You exercised your option. You're standing in front of me with a bare face, and I'm wearing a mask and the patient is wearing a mask. Why are we talking about this? Because if you as a provider were concerned that either one of us were infectious, like if we were currently ill with COVID, if you had any real concern about that, which properly you might, you would be masked already. Like and it came across as sort of I don't want to say like, but yeah, it was borderline hostile or uh, kind of passive aggressive. So I dignified it with only a very short answer and the kind of answer that did not invite further conversation. I just said, we have really high risk people at home, and kind of closed that conversation. Um, but what was interesting to me, and not interesting in a good way, is it wasn't as if we asked him to mask or anybody else who came into the exam room. So that was, and then we had a visit with a second opinion orthopedist at a small, well, it's a really big practice, but it's not affiliated with a specific hospital. It's, sort of um, privately owned, multi office orthopedics practice yesterday. And there was no sign on the door, but there was also, there were zero people other than us masking, but at least nobody asked us, you know what I mean? Like, it was just not discussed. But yeah, the experience 2 weeks ago was not great, because here you've put a sign on the door, you're not masked. Clearly, you've announced your risk tolerance for this situation. So why are you asking me? Was sort of the feeling I had.
Yeah, I hear you, and that's stressful for me. Uh, yeah. And it looks like Jennifer may be joining us soon. That's what the ding was on my end. But uh, yeah, I always find that early stressful to be in situations where it's mostly or entirely a one-way masking situation, because we do know that, one-way masking is way, way better than nothing, but it's
Not
far,
right.
yeah,
Not ideal.
yeah,
And
exactly,
and
exactly.
and that questioning by providers of me as a patient, or me as a family member accompanying the patient, has always been, um, that's always been weird to me, or like uncomfortable, because they're, at the point that governing bodies, whether that was your state Department of Health, your local Department of Health, your hospital policymakers, the owner of the practice, at whatever point those bodies abandoned um, any requirement or attempt at requirement for people to mask in healthcare settings. And it was just, the Wild West. It's up to everyone to do whatever they want. That's the point at which it, I think, also became a situation where it's inappropriate for the provider to ask, right? Like, I was walking, it was again with my husband, again, meeting a new provider. This was probably a year ago. And it was a nurse practitioner. And as we were walking to the back office, like through the common hallway still, um, she was kind of talking, not really to us, but more at us over her shoulder as we proceeded to her office, saying, well, what's up with the masks? Are you sick? Are you sick? And, part of, I chose to ignore her until we were into her office and the door was shut, because either she was asking the question from the standpoint of challenging our decision to mask, which doesn't affect her, or she legitimately wanted to know if either one of us were ill. But again, um, if she's concerned about patients coming into her office who may be ill with COVID, her nexus of control on that is to put a mask on her face. Um, so yeah, it was sort of, I don't know, that um, I guess I tend to clump those healthcare providers into the probably not worth I want to say like dignifying the question with an answer or not worth engaging with, um, compared to the providers who may, they're not wearing a mask when I get there, but they see my mask and they either mirror the behavior and they put one on, or they ask me, would you like me to wear a mask? And usually, even if I say yes, it's an in effect, it's a baggy blue surgical mask, but at least they're being sort of socially appropriate by mirroring what the patient is doing to put the patient at ease or make them feel more comfortable, even if it's not, 100% effective, um, from uh, an infection control standpoint. At least they're being, decent people about it. Um, And then somewhere at the other end of the spectrum are providers who are giving care where their masking makes a very big difference to my experience as a patient. I'm thinking of the dentist's office specifically because I can't mask when, the hygienist is cleaning my teeth. Um, that where there's hostility there, those folks are, those are the ones I probably invest more time and energy in figuring out an approach to talk with them about it, because I have so much more skin in the game if I can't wear my own N95.
Yeah, those are all like really valuable stories. And as I mentioned earlier, Jennifer has now joined us. Jennifer you're down in the DC area, right?
Hey, can you hear me?
We can hear ya.
Okay. Hey, Evan. Hey, everybody. Yes, I'm in DC and I'm struggling just a little bit because I'm on my phone. But yes, I'm in DC and I didn't know who was just talking, but of course that's the unfortunate situation across the board. So I'm going to be quiet and I'm going to let whoever talk
Oh,
next. And
hi, Jennifer. It's Christine. That's me who is speaking, and nice to meet you virtually.
yes, hi, Christine. Thank you. Thank you. But I actually am going to sign in on my computer. I just saw the message. I took a
No.
nap and I totally forgot. But sorry. But
Yeah.
I
Oh,
will
I
be
feel your
right
pain.
up.
I totally feel your pain. And like if we end up going over the like 40-minute Zoom limit mark, we can just like click on that link again and start back
Cool.
up. So if we get kicked off at any point, we'll just do that. Um,
Wonderful.
but yeah, so Jennifer, I believe you're also an RN, correct? Or did I imagine that?
No, I'm not an RN. I'm trained as a lawyer. I'm not
Yeah.
practicing. So of course I'm looking at this whole, conundrum as just there's so many issues here that we have totally been failed by public health, but it's just as all these doctors have a Hippocratic oath. I thought that they were supposed to protect us and not harm us. So
They
it just continuously boggles my mind of the battles that we have when we go to the doctor. You would think that at least with even the office manager, that they're there and say, oh, we have to protect the interests of our patients. And they are just not doing anything. And it's upsetting, but fortunately, with my primary doctor, she is somebody who does wear a mask. But going back to the conversation that, yeah, they put on the surgical, and that's what they're doing. So, of course, across the board, what's the problem? They are not getting the correct information of how to take the precautions to protect not only the patient, but of course them as the practicing doctor. But I go into a lot of forums where there are doctors, talking about this. And the sad thing is that they all know, and it's like they don't care.
so and that and all, just in service of being descriptive.
Mhm.
I got my first nursing license in 1988. Um, and when I don't work at the bedside at this point. Thanks be to God, honestly. But when I did work at the bedside, the unit that I worked on was a 46 bed medical, surgical, cardiac step down, but primarily a respiratory unit. It was ventilators, TB, pneumonia, trachs. Um, and in the late 80s, we were, was the AIDS epidemic. I mean, because of the nature of the unit I worked on, we had a lot of patients. There were two hospitals here in town who really saw a lot of HIV and AIDS in the 80s. One was our big university hospital, and the other was this little dinky hospital I worked in, primarily because we had an infectious disease specialist on staff, um, who saw a lot of folks with AIDS out in the community. And then when they needed hospital admission, he would admit them to our hospital. So working on a unit that had the negative pressure rooms for TB, right? We were all fit tested for N95s. We were accustomed to the idea that we worked in a setting where, and this is back in the, let me cite, this is back in the day before needleless IV systems and stuff, where we had occupational exposure often, way too often, to be honest, to both bloodborne pathogens, but also occupational exposure, usually to TB. And the way it would work is we would admit a patient, we would not know that they had TB. TB is very hard to culture out, and the cultures would come back 6 weeks later after the patient had been discharged, and we would learn exactly who had been exposed because they would go through the roster of whoever was assigned to that patient. But then you also had to figure out, did you go into the room, if the person wasn't isolated yet, or you didn't know and you weren't in an N95, did you go help the nurse assigned to that patient, and you weren't properly kitted out, you had an occupational exposure, and then you had to go through all the follow-up testing. So like, we as healthcare workers, like, we understand, like, I don't know what they're teaching in school now, but most healthcare workers of a certain age, we know better clinically, we do, but we're also human beings who are bombarded with social pressure and um, misinformation out in the public about the whole airborne versus droplet stuff. So am I not surprised when providers don't do airborne level PPE in an outpatient setting? I'm not surprised, but what I am surprised by is when they outright refuse, or they act ugly to their patients who ask them to mask. That part does continue to surprise me.
Yeah, and on that note, it is a very depressing state of affairs. Do either or both of you have any advice for, you know, when you go into the doctor, if the doctor is either being hostile toward you, as somebody who's masking, or is refusing to mask themselves, do you have any advice for what people can or should do in those situations?
Honest, like, on the spectrum of how, and just also to kind of fill details in. So my household is comprised of myself, my husband, who has medical comorbidities that put him at high risk of terrible outcomes. He's diabetic, he's hypertensive, he has chronic respiratory failure. We are also caregivers for my 88-year-old dad. Um, and also in our household is my young adult son who has um, a um, a like a primary immunodeficiency, like unhappy outcomes in the past, like from infections that wouldn't cause most of us that much trouble. Um, and and also has autoimmune disease. So like, and I mean, and speaking for myself, I'm reasonably healthy, but of a certain age at this point, and I have asthma, and I also had a bad, just a bad experience with good old fashioned influenza A about 9 or 10 years ago, which convinced me very solidly I never want to um, partake in viral illnesses that can follow you. So um, but in how to deal with healthcare providers, it's like, how much skin do you have in the game for that appointment or that episode of care? For my 88-year-old dad, who cannot, my dad has dementia. My dad cannot keep a mask on. He literally cannot. Um, when we take him somewhere for healthcare, where like to get vaccinated, we go to Costco. It's well ventilated. It's a big open space. It's not like you're in a little room. And we literally go as a little posse, somebody just to help him keep his mask on, somebody to talk to the pharmacist, so, somebody to push the wheelchair. Um, we don't actually take him, and this kind of horrifies me as I say it. We don't actually, he has not been in to see our primary care provider. We all have the same family doctor since they took masks out of the office, because I know the ventilation is terrible. We've taken the AirNet with us. The staff won't mask. It's a family practice, so there are always kids in there who are coughing and blowing. Um, and we do his annual Medicare checkup by telehealth. It's not ideal. And there have been times he's needed care that would have been better delivered in person. And we haven't, we kind of MacGyver it by telehealth, because I know that I can't keep him safe in that setting. Um, for other stuff, like if I think the provider will be curious enough to engage in a non-hostile manner, I clip my AirNet to my book, my backpack that I carry, my shoulder bag. And I've had providers ask me about it and like listen politely. So sometimes that's a way to open the conversation about it. Um, but honestly, the only time I really lock horns with anyone anymore is in settings where I can't mask. The dentist, I had to have my screening colonoscopy in this past year. And like in those settings, I've just said it from the beginning, like, hey, I'm higher risk, but I have a very high risk household. So I need, I'm going to need y'all to wear N95s. And if you can't do that, then I can't get care from you. Um, the dentist, we actually bring the N95s with us because the hygienists were uncooperative.
Yeah, that's honestly what I do with my GP, which I'm lucky enough to. I live in an apartment building where my GP is literally downstairs from me. So, uh, um, whenever I go downstairs, I grab a bunch of KN95s or N95s so I can just hand the nurses or my GP a mask when I go in. And thankfully for me, they're usually really, really great about it. Unfortunately, they don't do the mirroring thing that you mentioned earlier, but as soon as I hand a nurse a mask, she'll put it on. And in fact, this last time I had to go for my annual, um, when I handed a mask to my GP, he was like, "Wait, wait, wait! I think we've got them." And he, sure enough, he came back with a high quality respirator on, and so that worked out really well for me. But yeah, it's definitely scary
Well,
world out there. Go for it.
and it's also I try, like I try to come at it, also meeting providers, when you're in that provider patient relationship in the exam room, you're not you shouldn't have to be there to be the person who's educating them or supporting them or whatever. Like that's not really the setup. But I try to be like actually sort of super forgiving about that, in probably more than I ought to be. But I know like our dental practice, we all go to the same dentist too. And it's this kind of open plan where none of the dental exam rooms have doors on them. So, whoever's coughing in across the hall, like and the ventilation's completely inadequate. I mean, it's the whole package. But when initially they were like, oh, everybody wait in their cars. We'll call you when it's time to come in. Patients all have to wear a mask. You have to rinse with like CPC mouthwash and spit before you get in the in the exam chair. And pretty much when our local government, went, woohoo, no masks, they climbed right on that wagon all the way. And getting them to wear an N95, and I'm thinking, I don't have any problem personally bossing people around. It's a professional weakness or whatever. But like when my son would go to the dentist, it felt like start at the beginning again with, hey, remember he's immunocompromised. Yeah, so you're going to need to wear a mask. And yes, it's going to need to be an N95. What? You don't have N95s in a dental practice? Okay, well, we'll provide you some. And yes, they're individually wrapped. And you can, I felt like I like handing out Halloween candy, like you can pick your flavor. Like, but then had the hygienist give him blowback about wearing a mask, and then also the last time he was there about like kind of I think it was Gabe. It might have been my husband, but somebody was getting blowback, getting grilled about, well, do these masks, are they latex free? And that's the point at which it's like, if you require PPE at work and you need it to be latex free for yourself because of allergy or whatever, like you're talking to the wrong person. You should be talking to your boss. You should be talking to your office manager or the dentist you work for. But that needs to stay out of your conversation with your patient who's in the chair. Um, so yeah, I don't know. I will say for us, I guess I limit how much I engage at this point to settings where I am not able to protect myself with my own mask.
Uh, Thank you so much for that. We are at a little under 4 minutes left on our Zoom time, so I'm just gonna say let's log out and log back in again, just so that we have more time and that I don't accidentally and so that none of us accidentally gets cut off mid-sentence. So see
Sure,
you in a
no
sec.
problem.
Awesome Possum, we are back from our forced hiatus. As a reminder, I'm Evan from the Washington Heights-Inwood Mask Block. I have with me Christine, an RN from Ohio, and Jennifer, a COVID smart lawyer from Washington, D.C. So, All right, yeah, we were just talking about, Christine here was talking about how she kind of tempers her expectations with certain providers and picks her battles. And I would be very curious, Jennifer, from your perspective as a lawyer, like what have you done or been able to do for you, your family, etc.?
Okay, well, I'm going to start with how I always do this, but it's now a new technique that they're telling me that I have to do. So initially, I have always called the day before the appointment, and I've spoken to, the front desk receptionist. They told me, yes, it's in my mother's file because it's usually an appointment for my mother to wear a mask. My mother, I'm a caregiver to my mother who's 84 years old, so she's definitely high risk. And when I get there, when I physically get there with them, I actually wear a button that says I'm immune compromised. I really am immune compromised, but I also wear the button so that hopefully that speaks for myself, where they're not questioning, despite the fact that I do have my mother who is high risk in the room with me. Fortunately, we have only had a few problems. We went to my mother's cardiologist, and for some reason, I was intimidated to ask the doctor to wear a mask. I really don't know what happened, but he didn't have on a mask. And mind you, I actually have a heart condition. So if anyone, this man really should have had a mask on. But I really just had to just give it up to a higher power. Fortunately, we were okay. That's like the one place that I really do remember, having an issue. Another time, I'm trying to think, that was, oh, so we go to George. So I'm here, in Washington, D.C., and most of our doctors now are at George Washington University, which is a teaching hospital. Okay, a teaching hospital. And usually in most of the rooms, they have a sign that says, you can ask your healthcare provider to wear a mask. So we just had an appointment last week, and the tech who dealt with us, they didn't have on a mask. They actually said, would you like for me to put on a mask? And I said, yes. Then when the doctor came in and I had to tell him again, I would like for you to put on a mask. But I said something that made the doctor actually say, oh, thank you for telling me this. So I said to the doctor, we may be asymptomatic with not only COVID, but with a virus. And I would feel just so awful if I got you sick. Do you know that her whole demeanor just changed? It was almost like, oh, wow, she's really thinking about me. So I think right now we truly are dealing with mental gymnastics, and
Mm-hmm.
it's how we approach. We can't be so accusatory. It's almost as though we have to be like Mr. Rogers, where Mr. Rogers was very gentle in talking. And when we talk like that to the doctor, it's like, oh my goodness, thank you so much for caring about me because no one really cares about me. So that's been my approach now, I would say this year. In addition to going to the doctor, we have been in and out of emergency rooms since the height of the pandemic. So I really can talk from firsthand experience of what I've seen. In the beginning, I wasn't even allowed to go. So my mom, we've had the EMTs come into our home. We live in an apartment building, and they've come into our apartment with all of the gear on, meaning, a mask, even covers on their shoes. This was like at the height of the pandemic. Now they don't wear a mask, they don't wear anything on their shoes. And mind you, they come into our home. I have on a mask. Mind you, in my home, I have on a mask. I have a sign on my door that says that we are
Mm-hmm.
high risk, please wear a mask. And I keep masks at my door. And they just act as though whatever. But what's interesting, the last time this happened, and I guess it was a new person because unfortunately, I think we've had almost every EMT in this particular area come in and out of here at least 3 or 4 times. But this guy must have been new, and he said, "Oh, I see the sign for that you would like for me to wear a mask. Do you have one for me?"
my heart just melted because I'm like, wow, they actually paid attention. So again, it's mental gymnastics, but also having signage in terms of if you're in your home, please put up a sign that says, please wear a mask and have masks available for whoever's coming in. And then two, when you physically are at a doctor's office, if you don't see a sign, because even when I asked the doctor to wear a mask, I actually pointed to the sign. They're like, oh, okay. It's almost as though, okay, this is in our policy. If not in the policy, that's when I just say, my mother's high risk, I'm immune compromised. And then they're like, okay. But you know what? The whole time that we're asking, we're getting infected because their mouth is just wide open and looking at you like with these doe eyes as if to say, I really don't know what's going on, but I'm just going to listen. Okay, what do they want? And Evan, I like the term that you said, mirror, because it's not even like they want a mirror. It's just as though they're just lost. They completely look lost. So it makes you wonder, are these doctors, I actually just read an article about this, are these doctors, techs, and nurses, are they experiencing long COVID? Do they have
Yes.
brain fog? Do
Yeah.
they really understand that they are experiencing what we're trying to not get?
Right.
So I think there's so many factors to this where honestly, I'm very concerned, at least within the next 5 years. I honestly think that our healthcare system here in the United States will completely collapse. And the only reason why I say this is because for me in Washington, D.C., going to our GW is literally about a mile and a half or 2 miles from the White House. For me, any of us, to experience that right here in Washington, D.C., that tells you there's truly a disconnect, just, at least here in D.C. But I have to say, I have a friend who lives in Washington State, and she said, no, all of their doctors, they do, and the nurses, everyone in the hospital that you go to or to a doctor's office, everyone wears a mask. So it tells you it's such a different policy.
Yes. Yes.
Every,
Oh, that
yeah.
is so in my current work world, I do catastrophic case management for a giant health insurer who shall remain nameless. And I work telephonically, but that means a part of this is I have patients all over the country. So at least through my interactions with them, kind of have a bead on how healthcare in Washington State looks different from healthcare in Florida. And it also means that since I have to be licensed in every state where I have patients, I also get the weekly, or Washington State is actually really good about weekly updates. So I get all the, like, their state Department of Health or their Board of Nursing, or their infectious disease updates, or that kind of thing. And yes, it is so location specific, which is why, I mean, like here where we are, Cincinnati, Ohio, I expect hostility, to be honest. And there's I think it's great that, like, where you are, like GW is still got signs saying, hey, if you want your provider to wear a mask, they will. That's light years ahead of where we are in Ohio anyway. Um, yeah, and as to the long COVID question, so a good friend of mine, who is a mom, I I want to say she's about 5, 6 years younger than I am, so early 50s, um, who is a second career nurse. She went to nursing school. She graduated the first June of the pandemic. And she came out of nursing school and went straight into a critical care, like residency at incidentally, the hospital where I was telling you, Evan, that we took my husband to the orthopedic clinic a couple weeks ago. And she worked in the ICU during the absolute most horrific, initial peak. And she was working at the bedside in the ICU when nurses were reusing N95s and trying to double mask in surgical masks to protect themselves. Working with COVID patients in the ICU was absurd, because I remember I had N95s at home from other things, and I had some surgical masks too. And I remember, like, when we were under stay-at-home orders, bagging them up and dropping them on her porch because they were being limited to a fresh mask every other day at work. But long story short, my friend, she used to jokingly say she was microdosing COVID every day at work. It's not really funny, and it is probably, in fact, very true. But she, she went after this as a second career because she really wanted to do it. And I know our conversation about 6 months ago, she'd been off work on FMLA trying to get herself well enough to return to work because long COVID had pretty much ruined her. So, Jennifer, I think you're right on the money that unfortunately our healthcare workers are, I think, not a resource we're going to be able to count on forever if we don't figure this out better than we have.
Yeah, and speaking from personal experience, my previous GP before my current one, um, they were both in the same practice, partners in the same practice, and my previous GP was absolutely phenomenal at masking. And unfortunately, she had to step out with long COVID, and it ended up being such a long period that she literally just couldn't practice because it was such a severe case of long COVID that she's retired now. And, I'm now with her partner as my GP, and I miss my old GP so much because she was just phenomenal, but she was the only person regularly masking in that facility. And this is my personal speculation, but I'll bet you dollars to donut nuts that she got it because nobody else was masking for such a long time. And it just, that
That's
hurts my heart.
that is, but that's also, like, that is part of this, that seeing it from the perspective of a healthcare worker who used to work at the bedside in a fairly high risk setting. And, speaking about like respiratory pathogens, right? Like, I worked on a TB unit, right? That was kind of, but also, like, I know how it was at the bedside, and TB is much, much harder to catch than COVID is. And yet, if you were not fit tested, if you were supposed to be in an N95 in a room and you were not, and you got sick from it, or even if they just caught you and, were feeling grouchy that day, they could write you up and suspend you, send you home. Like, no pay for 5 days if you weren't in appropriate PPE. And now we've gone, it really is sort of Alice in Wonderland like. Then we went through the early stages of the pandemic where we were expecting healthcare workers to work at the bedside without adequate PPE. And now we've got PPE, and people are, who work in healthcare are acting like, I don't know, they're magically immune or something. Yeah, that's quite a quite a thing to process cognitively, I guess.
Yeah, it really is. And I'm curious, Jennifer, if you've had any experiences with people refusing to mask even in despite request, and if you've been able to do anything about it or, not been able to do anything about it.
Oh, yes. So let's start with that. I can think of three distinct times. One was just for myself. I had an eye doctor appointment. There was no way I was not going to allow that doctor not to. And I specifically asked for N95. And I had called the doctor's office and I said, and this is again at GW, and they said no, they were not going to wear N95 masks. I said, all right, I'm not coming back. So I haven't had my eyes checked out since then. Another time was actually with my mother at the ER. They thought my mom had a stroke and they had to do an x-ray. And I asked the x-ray technician to wear a mask. He said, I don't have to. I was like, excuse me, I'm requesting as the caregiver of my mother who's high risk if you could wear a mask. He said no. So I immediately went to the charge nurse and I told them he still was with my mother alone in the room, getting the x-ray. Fortunately, she was okay, but still for him to outright say no like that to me. So I did, speak to the charge nurse. She told me, she was going to do something. I don't know if she did anything, but what's interesting, we went back to that hospital. He was there again, but fortunately he was not working with us. And of course he wasn't wearing a mask. So I'm trying to think of the last time this happened. You know what? I can't, but I actually wanted to share something that happened about now 2 years ago. So my mom has to see a specialist. I forgot the name of her specialist, but it's a small medical practice in a building where you have all these other specialists. And it wasn't my mother's doctor, but it was a specialist sharing office space with my mom's doctor. And that doctor said to us, why are you guys wearing a mask? And we were like, there's this thing called COVID, and we're not trying to get sick. Mind you, we're in the doctor's office. So then she said to us, well, I just want you to know that masks don't work. You need to read this article by the Cochrane Report, which is she was like, it's the top tier when it comes to dealing with medical, I guess, journals, essays, or whatever. So I was like, okay. And I just kind of rolled my eyes at her. She rolled her eyes at me and I walked out. So I, of course, Googled it and I found out that there was an article by what is it again? The Cochrane Report. But they actually retracted what they said. They said that they did not have enough evidence to prove that masks did not work. So of course, me and how I am, I immediately called the doctor's office and I said, that doctor was wrong. I did read the report. Read the retraction. And what was interesting, the person who answered the phone said that I handled that doctor very well, how there's someone who continuously has a lot of opinions that are very harsh. But they just said, they even appreciate me just calling back. But that's what they're working with. But the people at the front desk, they don't wear a mask either. And what's interesting, they had the plastic barrier, to protect them from patients who possibly were sick, but they took away that plastic barrier. So I'm just like, as you guys probably know, the CDC had a group called HipPAC. And HipPAC is a group that was dealing with, sanitation within medical facilities. For the past year, this is probably like the last year under Biden, there were a lot of issues that were brought to that committee when it comes to masking in healthcare. And they basically came down to the conclusion that masking didn't work. And there was one person on that committee who wore a mask during this recorded talk. And they were saying, all the reasons why we should be masking, how we're continuously living in a mass disabling event. But still, the committee was like, nope, we're not going to have a universal policy when it comes to masking. So this was like I would say last year, maybe around this time. What's interesting, that committee was supposed to have a meeting maybe like in March of this year. And of course, we have this new administration of, 2025. And this administration actually got rid of that committee.
Mm-hmm.
They totally got rid of that committee. And this administration also got rid of the committee that deals with the high testing of N95 masks. So you've heard of that term, NOSH, NIOSH. They got rid of that entire committee. And that's the committee that makes sure that your protective gear that is of a high standard. So whenever I buy my mask, and I prefer wearing duckbill masks, I always make sure that they're NIOSH approved. Whenever I buy my masks, there are certain places that I buy them, which are usually not Amazon, but medical equipment, medical supply
Right. Yep.
companies. And what's interesting, and I'm sure have you guys ever heard of the mask called Blocks, BLOX? I
Mm-mm.
love those masks. They were duck bills, very affordable. When I say this, we're talking about an average, I think it was like 15 or 25 cents per mask. So I was buying boxes because I could afford these. And my whole thing is that if a neighbor asked me for a mask, I had no problem. Well, what's interesting, that company stopped making masks last year because they said essentially the pandemic is over. I was so shocked to see that. And the reason why I bring this up in this conversation is that when you're talking about the expense of having N95s in the office space, I highly believe that everyone should be using a duck bill. And the reason why is that last year there was a journal article by the University of Maryland that said that duckbill masks are the best masks when it comes to blocking specifically COVID. And the duckbill masks, when I say affordable, we're talking about, again, maybe 15 to 25 cents per mask. All this money in healthcare, all this money in insurance, there should be no issue of having these particular masks specifically in healthcare settings. Because in some articles that I've been reading, more so, I would say medical journals I've been reading, they were saying they really should have duck bills in like the assisted living facilities, aging facilities,
Mm-hmm.
and of course in hospitals. But then again, we have to factor in that not all of these masks will fit certain bases. So of course, maybe there could be adjustments to those masks. But there's so many factors into this. I try to read as many of the articles that I can, the medical journals that I can. And it's to me, sometimes it's not as hard to read them because you have, they give you your intro, they give you, your conclusion. I might read some of the analysis. Of course, I'm not familiar with any of these scientific terms, so I'm just like, what are you talking about? So when you read, the summary, the intro, the summary, and the conclusion, you get a gist. It still boggles my mind that our medical doctors who have passed these board, to get their license, that they are not doing to me the work. And I know that not all doctors can keep up with this, but at least if they had a summary of what's going on weekly when it comes to infectious diseases, every doctor, I don't care what type of practice, if you from your eye exam, to your dentist, to just general practice, they need to be reading what's happening in infectious diseases. I just think that should just be something that should be standard because if you have to have these practices like now, since the HIPAC committee is no longer in existence, it makes you wonder, okay, what standards does this particular medical practice have when you go into their office? Are they
So
wiping down? Are they wiping down their equipment?
And that you actually hit on like a really hugely important point. And that is that individual that when we, and like another, actually a friend who is a friend in common with my friend Tessa, who I described, who went back to nursing school midlife. We have a mutual friend, Carl, who is an industrial hygienist. He works for OSHA. And he was actually when the pandemic first started, there were American citizens in China, like doing whatever they were doing before the outbreak started in Wuhan. And we sent basically a military aircraft to bring those people back to the States. And Carl actually, as an industrial hygienist, this is like his very narrow jam, if you will, and went on that flight to retrieve American citizens and get them home. But NIOSH, like when we talk about controlling COVID or other things that are airborne, really, to be honest, we don't want the physicians to be in charge. Like, yes, infectious disease has its place, and I want a good ID specialist taking care of me if I get COVID, but I don't want them in charge of preventing me getting COVID out in public spaces. We need better, we need EPA and NIOSH making common spaces like medical practices and hospitals safe, regardless of what individual people are doing. And it's like we have the technology, we have the ventilation standards, we use far UV air cleaning in setting, like we do it now. It's just we don't do it in enough settings. We use it in ORs. ORs have 12 air changes per hour. ORs use far UV. There's good reasoning behind it. If we would let the industrial hygienist and the aerosol engineers be in charge of, I always use the analogy, like I don't want to have to carry my own plastic bottle of water to every, I don't go to restaurants anymore, but like if I went to a restaurant, I don't want to have to bring my own clean water. I want the restaurant to have clean water as a standard that I expect anywhere I go. And if we could get some steam behind that, where, even if you went into a medical facility and your care providers were not masked, if you were receiving that care somewhere that had, an AirNet reading of 500 and it had far UV up in the ceiling, and, I would feel honestly much better about receiving care from an unmasked provider, or even being unmasked myself in that setting. I wouldn't sweat it. But there's something called the hierarchy of controls, and it looks kind of like a little upside down Maslow's pyramid. And it talks about how we make environments safer, and we use it in reference to infectious disease. First, you try to make the environment safe. That's the broad end of the pyramid. And then the skinny, pointy end is PPE, where we have to bring it down to the level of the individual to keep people safe. So the mask should actually be your last point of defense. And unfortunately, we've made it like the only point of defense in so many places that it's, we're having to do battle with individual providers. But
and I always say it's like so important to have a layered approach, because goodness knows you can catch an airborne disease outside where presumably you've got freaking great airflow.
mhm.
Yeah, so it's so important to say yes and to all of this. I personally think anyway.
Yes,
And
yes.
uh,
The
um,
And I will share that my family's and I remain in the, I always say I'm in the control groups because I have not had COVID yet. And I realize it is a bizarre, delightful intersection of I work from home, I'm comfortable masking. I, you know, my last kid in compulsory education, um, their school closed in March and they never went back. You know, I realize I'm fortunate beyond belief in that way, but my family's last COVID infection was July of 22. And unfortunately, it was acquired by my husband and my 88-year-old dad because they went and they ate outside. They went to I don't know if they have them in New York, Evan. It's a chain. I think it's fairly local, but a chain called First Watch. It's like a breakfast only place. And this is when the narrative was being pushed that, you know, oh, you got your vaccine, you're golden. And my little dad was jonesing for going to a restaurant. So my husband agreed and took him, and they sat outside on the patio. And probably the only person who came within arm's reach of them was the server, but that was enough. So yeah, layered approach.
Christine, thank you so much for saying that, because when I make videos on TikTok about this, and I always talk about the layers. And I always say, you know, the mask is just one thing, but we need to make sure that we have the ventilation, which is, of course, the air purifiers of a HEPA or a MER 13 filter, and also the far UVC lights. The thing that I know is that when I went to one of my doctors, they were like, oh, yeah, the ventilation has been changed. But for me, and when I go into these doctor's offices, everything is enclosed. So even if you say that the ventilation is on such a level, I can't tell with my naked eye what is actually going on. Because honestly, I don't think some of these people are being truthful. I really don't.
That's why we do have an AirNet, and I actually I think my kid found the little gizmo on Etsy that allows you to pop it's just like a little 3D printed holder, but you can pop the little AirNet into the little holder and then hook it to your backpack. And I do that when I go to medical appointments. If it's sort of that middle ground, you know, like I said, like there's some people I don't engage with, and then there are people that I will engage with, and then there's the like mushy middle, like I don't know, is this doctor going to be, you know, a jerk? Or but I will take the AirNet with me clipped on my backpack, and I've had providers go, oh, what's, you know, usually it's the MA or the nurse will say, oh, what's that? And then you get, you know, your 2-minute elevator speech about, oh, this is a device that lets us know what the CO2 level is in the room. And that's a proxy for understanding how good the ventilation is. And it has the little helpful, you know, red, yellow, green bar at the bottom. But that is you know, sometimes that's a conversation opener if the person is at all receptive to, you know, to talking about mitigation. But I will tell you, some of the places I have been with the worst ventilation ever is actually my primary care office. They've been in their new office setting for like 3 years, I think. And the new office, new relative to where they were before, always has readings of like almost 2000 in the exam room. It's bad. And I know that they're, you know, by the time I'm there, you know, they've probably seen 10 patients in that room, and none of the windows open, and the CO2 is, you know, 1800. And, you know, I'm sure that anybody working in that room is breathing in everything that was just there. And that's actually something. So I don't know. Well, Evan, I know how old you are. But when I got out of nursing school, it was a standard that in not in adult practices, but pediatric practices, had a well waiting room and a sick waiting room. Why? Because young children are, little germ factories for airborne illnesses. And, this is back before everybody was universally vaccinated against chickenpox. And so if you called your pediatrician and you're like, my kid's got a fever and a rash, yes, you came into the office, but you were sent to the sick waiting room. And in no way would you have that child in sharing the air with, all the babies there for their, checkups. But yeah, layered approach. We don't do it nearly enough anymore. But some of it we seem to have forgotten too.
Yeah, I definitely remember those well and sick waiting rooms, and I have so many times wished that we still had those for like adults, you know.
Yes, yes. Um, yeah.
Yeah. But yeah, we've got a couple minutes left on our Zoom, and we've done two Zooms, so do y'all have any last thoughts before we say goodbye?
Quick thought. I want to make sure how we talk about wastewater. I really think that if we can detect COVID in our urine, that if that would be a new test as opposed to the swab, because you know how we're always checking the wastewater to see about COVID levels in certain regions. Why not? Why can't we do something like that when it comes to COVID? I think about pregnancy tests, and I think you pee on the thing or whatever. We need that for COVID. I'm just throwing it out there. So that's my last thought.
Yeah. I'm here for it. And Christine, any last thoughts?
Um, just that I would like to see us get to a place where we normalize talking about it. Like I said, just the analogy of like the thought of having to bring your own bottled water to a restaurant, like how absurd that seems, right? Because there are certain things we take for granted. um you assume that if you go to a public place and you turn the tap on to fill a glass, that the water that comes out will be clean. And yes, we know there are certainly places, in our nation where that is not true, but it's still the assumption. And I would love for us to get to a place where our built environments are, have that assumption underlying them. That our indoor spaces can be safe.
Thank you both so much for your time today and for your patience with me. I hope you both have a great day, and thank you so much again for being willing to be interviewed about this kind of thing.
Thank you.
Sure, thank you.